A little bit after 9, and the first thing on the agenda today is the sheriff appointment, making it official, action item on the agenda. So we saw all the different people that applied. We didn't really do interviews, but I don't know if we necessarily needed to. And
That was a pretty unanimous decision, I think.
yeah, so, I don't know, is there any discussion or comments, or do we just?
What are you guys thinking? Just to make sure.
Well, who wants to go first? Or do we?
Well, I guess on the discussion issue, I just have one question for Boone. You are interested in
Did you see
doing
the
this?
letter from yesterday?
I mean, I really haven't had a chance to talk to you much about it.
Yeah, did you read my letter that I submitted?
He submitted a letter
Oh,
yesterday.
no,
Oh,
I guess
yesterday,
I seen
yeah.
your letter from yesterday.
I
Sorry?
submitted, I think it was last Friday, whenever it closed. That day.
Mhm.
Okay.
Got nothing better to do.
Yeah. Hanging around it?
Yeah.
That was my only question.
Yeah, and he's planning on running, so.
Oh, good,
Yep.
good.
And the wife's okay with you biting off a bigger piece of the pie?
Yeah, I mean, what else are we gonna do, you know, all the kids are out of the house, so
Mm-hmm.
keep them busy, I guess.
And I think the only thing I was worried about, and I think it got cleared up, Tim even said it happened in Lake County, but the only thing I was, did you have a chance to make sure that he's
I haven't.
golden on?
If he does file,
Yeah.
I haven't had a chance to, but I will.
I think
Definitely
I think
follow
he
up on
is,
that.
but yeah.
Yeah, because that's just the one difference is you're not in your term right now. So I think I almost feel like that wouldn't be fair.
Right.
But there's been other times where I said, "Oh no, that can't be," like with longevity.
Yeah.
And then I read the law and I'm saying, "Oh, I was wrong." So just because
Yeah.
I think that doesn't sound right, I want to make sure I check it, and then we run it through to make sure that.
So what
it's okay.
didn't sound right to you?
Well, we were talking about a lot of times when the elected officials, if they run and lose, they're out of a job.
Right.
You know, the sheriff loses his job. If I ran, I'm out of a job. It's not incumbent upon you to find another place for me to work in the county. But if Boone should choose to throw his hat in 2018 for 2019, if he should lose, if somebody should run against him and he loses, would he be out of the sheriff's department? And normally that would be when you're running, but he's filling in on a term right now. This isn't his term. So I think that might be a little different kind of legal analysis. It might not be, but I almost feel like this isn't the term that he ran on. So he might be able to stay in the sheriff's department.
Yeah.
Because that's a big decision. Does he want to, and actually Sheriff Boone and I have talked about it.
Mhm.
That's a gamble.
Mm-hmm.
Does he want to run? Of course, a lot of us want him to run, but he has to think about that, and he has to know, if I run and lose, can I still stay in the sheriff's department? Because he didn't run for the term he's serving right now. So I just want to make sure we have straight answers for Sheriff Boone before he decides whether or not to run for next term.
And Tim said that that's happened in Lake County before, and
Yeah.
they never lost their position in the.
Right.
Yeah, if it was his own term, like subsequent year, if Boone runs and wins, then runs again in the next cycle and loses, then.
Then,
Then,
yes,
yeah.
right. So that was, Tim Reed was saying that happened up in Lake County, so I'll check with them. I said, this is great, we'll reinvent the wheel, see how they did it, make sure it's all clear, and then I can get you an opinion so everybody's comfortable with that.
Other people's here, anybody else want to say anything before?
No, we want you to make your motion.
We have
Then
a
we
whole-
might have something to
This
say.
is all slotted for an hour, so we're.
Oh, great.
Yeah.
Waiting for the protest period.
I was waiting for you to go get
That
those
could be
donuts
the
and come
hour.
back.
That could be the hour. The protest.
I was waiting for Ellen to bring more of those really good donuts. Yeah.
Oh,
Just a
Next
little
time I go
hint,
to the prison.
A little hint.
Next time you go to the prison.
Yeah, I'll make sure
Could be
I've done this
Could
for
be
you.
a Christmas.
I was only kidding, Tim. All right.
Well, I will make a motion that we appoint Mike Boone as our sheriff.
I would second that motion.
All in favor of the motion to appoint officially Mike Boone as sheriff to finish out the term, say aye.
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 Any opposed? Seeing none? Congratulations.
Yay. It's great to work.
Sigh of relief.
Yeah, we have a whole hour,
I
Mike.
was, yeah, I was gonna
You
say.
didn't need to lose any sleep over it last night.
What did I do?
Yes, that's what I was gonna say. Now he's realizing the enormity. Thank you so much. I appreciate
Yes.
that you're willing to step up.
And anything we can do to help you, Mike,
I appreciate that.
Yeah,
You know, number
we're
one
here
thing
to
is getting
support
that-
you.
Getting that jail going, so.
yeah.
Have you already done that too?
Oh, about the lawn thingy?
Yeah.
That's, our decision on that is on the 15th, I believe, right?
Well, are you
Yeah.
gonna have input today?
Well, we have public comment, 11:30, we'll gladly take input, you bet. Yeah. So, yeah, if you, I'm just letting you know in case you didn't want to think we're wasting your time,
What
but
else is on?
we
the
have a Board of
agenda?
Health meeting starting here momentarily,
Oh,
and then 11:30, so after this meeting, we'll have public comment, and we'll gladly take anything you want to talk about, from the lawn statute to whatever you got on your mind.
so are you planning on making a decision on when?
Friday, December 15th,
So you're still getting information at this point?
yeah, we're still receiving emails like yours and others,
Okay.
and I don't know why, anyway, we made it for it was made for the 15th.
Well, I think one of the persons that wanted the statue originally couldn't make it until the 15th.
Oh, yeah.
So
For,
it's
Isn't that
been
correct?
rescheduled, because it was supposed to be today at
I think
10.
it originally was, yeah.
Yeah, and that's what I told
Are,
him.
are you on our little distribution list with Casey, so for
For the
agendas?
agendas?
Oh, if you want to give her your email, then whenever the weekly agenda comes up, or if there's a revision, then you'll get it on your, so that you're
Okay.
not coming down here and being disappointed.
Yeah, when things are changed.
Right.
Yeah, so,
So,
yeah, that was the last word I got.
okay.
There you go.
Well, thank you.
Yeah,
And congratulations.
Yeah, just give Kate, if you guys want on the emails to get the commissioner's agenda, just give your emails to
Okay.
Casey, and
Okay.
that way you'll get the agenda. She usually sends out a tentative agenda, like Monday,
Okay.
Tuesday, and then the final agenda comes out on Wednesday, so.
Okay, we will do that. Yes. And we understand,
Yep. Our appointed sheriff.
good choice.
Mhm.
Congratulations.
They get bullets and everything? Hey, one.
That's all he needs.
Yeah, we're calling him Barney Boone.
One a week.
Are you staying? Are you staying? Are you staying?
We're just kind of waiting for Tim.
Yes.
I'll call the Board of Health meeting to order.
Oh, that guy, yeah.
The first item on the agenda is minute review. I hope everybody had a chance to review the minutes. And if so, I guess I would ask for a motion to approve them.
I'll make that motion.
Do we have a second?
I'll second.
Have a motion and a second to approve the, what was the date on that? August 25th?
25th?
Minutes, the last Board of Health meeting. All those in favor say aye.
Aye.
Aye. Opposed? Motion carries. Unfinished business. Animal investigation portion of rabies exposure incidents and the need for the development of a protocol procedure to ensure appropriate hand-off follow-up update from Jen Donovan.
All right. Well, I don't have very much to report on this because school started at that time and I've not had much time to delve into this. However, DPHHS did release their investigation guidelines, which I was kind of waiting for. And so my next steps will be to kind of review those, which I actually need to do today because we found a bat in the kindergarten classroom in Alberton.
Really?
So I'm gonna have to, a dead one that a kid touched. So I'm gonna have to kind of figure out what to do about that today, and they're not open, so there might be some going through trash to try to find this bat and stuff. So I'll see what DPHHS has to say about rabies and stuff. Anyways, that's the next step, and then I'm gonna pull together a work group, and hopefully we can move forward. So, cases, since August, we've had 4 dog bites and then 1 bat exposure. Today will be 2. And that's about it. This totally went to the back burner.
Okay.
And I will say, though, that we've had a pretty good partnership with the town of Superior. If the animal bite occurs within the town limits of Superior, they go out, and we've been working together on it, and it's been wonderful. The animal owners have been very cooperative, so that's been a really nice partnership.
So what do you mean by 1 bat exposure? You said so many dog bites and 1 bat exposure.
Yeah, so we had a bat that was found in a
Oh,
yard.
bat
Yeah.
exposure.
Bat.
Ah.
Mhm. Yeah.
Batman and Robin.
Yeah. And initially, the folks who found it said that they thought it had some punctures on its back, and so I had them bring it to me, and it was actually fully intact, because I was worried if the bat, it looked like it had been killed or died that night, and they found it in the morning. And I was worried that, like, if a cat had gotten it or something like that, then I was trying to figure out how we were going to go about that. You know, because it was found in a certain section of the neighborhood, but animals are outside all night, and who knows who's vaccinated and whatnot. But the bat was 100% intact, so that was great.
Were there any immunizations given in any of these 4 bites for people?
No rabies prophylaxis needed. All the dogs checked out okay in their 10-day observations.
Okay.
And people have been really compliant with bringing them to the vet to have their health check at the end and getting up to date on the rabies vaccination. So far we're on a really positive streak.
Were they all vaccinated,
No,
the dogs?
no. But they were all healthy on day 10. and
So if the
okay.
bite does, remind me again, if the bite does happen and the dog has a rabies vaccination, does it still go into the quarantine thing?
So every animal that bites has to be observed for 10 days, because if they show signs of rabies if they're able to transmit rabies when they bit, the animal will show signs of rabies within those 10 days. So regardless of whether or not they're vaccinated, we have to observe them for 10 days. If they're healthy on day 10, then they're good to go, and the human doesn't need the rabies prophylaxis. The trickiest part of all of it is that I feel that a licensed veterinarian has to look at these animals, because the signs and symptoms can be super subtle. And so that's just the main barrier we have, because we don't have a licensed vet in Mineral County.
Right.
How was that expedited as far as the vet is concerned? Somebody from Plains came over, or we took
No.
the dogs there, or
The
Missoula,
owners have been bringing their animals to their vet.
or- Okay.
So we haven't had anybody say I can't do it since August.
And then the vet gives you a report.
Yep. So we require a written report from the vet, these faxed over.
Of those 4 that you mentioned since August, are these primarily in the city of Superior, or we have some out in the boonies?
I think 3 of them were in the city of Superior. Yeah. So,
It didn't require any intervention by law enforcement. Nursing staff basically took care of it.
yep. Between our staff and the city of Superior folks.
Okay.
Yep. So people have been responding pretty well. So it still is something that we need to figure out and just write it down,
Mhm.
just to have the process in place. So it's on my list.
But the DPHA, that they kind of cut out some of your work for you. They got some kind of a regimen that they put out for counties to kind of follow?
I
Or?
hope so. I haven't looked at it.
Yeah.
It's quite a packet. So
Oh, is it?
it's
Okay.
probably going to be
Nothing
fairly
simple.
in-depth. No, and I don't know if they just addressed domestic animals, the dogs, cats, ferrets, or if they went into bats and wild animals as well. I'm not sure, but I'm going to look into it today.
Isn't there training coming up?
Yeah, they're gonna do their rabies road show again. So they've labeled it. They actually just sent out a survey to see how many people from our counties might attend, and I threw out probably 5. I don't know who. I was kind of thinking maybe Board of Health, maybe Town of Superior, maybe law enforcement. It was really beneficial. We went last spring, and it was really great. They went through rabies. Why is this important? Why does it matter? And then they dove kind of into what to do about it.
When are they having that?
It'll probably be this spring or summer. I'll let you know.
Okay. Anything else with regards to that? Any comments? Okay. Next item on the agenda is temporary food service license for large events, procedure and protocol follow-up. Update from Tim Reed.
Attempting to, I gave you a application of a large group last time that I plagiarized from a different county, but in doing something like that, you need something that supports and goes with that, and I think that's pretty busy and pretty complicated, but there'll be some things out there that they've kind of done a combined effort there where they put a lot of the rules and definitions in there and do that. So I don't think we need something that busy and that complicated, but so I've started drafting up a large group event permit and got that far on it, so what you see there today. So I think that's the direction I'm going to go with this, is to try to cut that down to something that's not quite so busy and have to go through in so many pages and do that. And have to end up taking it to Helen for the language. But to go along with that, then the Mineral County large group event rules, and in here what I'm attempting to do with that is put a rule together that we could would give the authority to issue the permits and go through the process. And so any typical rule, you have to describe what's going to go on out there, and I've tried to do that with the rule one, and then there's typical language that would go with that as far as what you'd like to see and review in that process, and what needs to be addressed, and some general language in there. So I added some definitions to it. There can be quite a few more definitions, but that's about as far as I got with that one. There'll obviously need to be some more with that. So then the probably equally important, and this is the part that definitely will have to go to Ellen to do that, is that if you can have a rule, then you need to have some kind of follow-up enforcement with that. And so I drafted up some language that would be pertinent. It's follows other trailer court, campground, or state Department of Health rules as far as what they do for fines and offenses and multiple offenses and stuff. So anyway, that's something that we definitely need to run by the county attorney to see if there's things. I didn't have time to really add the civil penalties in there, but civil penalty clause is important, because if you end up doing a lot of effort time by multiple departments, then civil penalties gives you that methodology to recover expenses by the departments or counties in there. So that's a area that we definitely want to be taking a look at and doing that. So the other thing is that I told a couple of the individuals out there that I was going to take a run at the license fee for this, and there's nothing that has to be set. All these can be altered and changed, but this really is the timing of the event where in the last couple they were more and more people were calling up closer and closer to the event and taking up more time, and acting like this was their first go-around when they've been doing this for multiple years, and so it was just like, give me a break, you know. You know what a plan review is and doing that, but, and I think in the end run, we only got stiffed by one grade apes. Is it grade apes?
Grapes.
Grade 8 crepes. He's the one guy that took us to the cleaners, but I got a long memory. He shows up again.
Yeah.
And then the other, and what really discovered last time was the amount of additional, I mean, I think some of those, that one gal out of California who, was her Sunrise, I can't remember, anyway, they're all strangers, but whatever, but she, we probably,
Elephants or something, I don't know.
yeah, some sun elephant something. But, you know, it was easily probably spent 6-7 hours emailing, phone calls with her and stuff. And no way to have any capture on time and for that. So this would be something that if we have this rule and somebody comes in here and wants to have an event and put on a temporary food service, first thing we're going to do is just have the rule on the webpage and have it out there right in their face, so that, you know, this is what you're getting into. And I think it would cut down a lot of this, oh, I didn't know and I wasn't sure, and doing that. So
And especially the last minute part of it, 2
Well,
days
that's-
before. And
that's the one thing that really, I mean, a couple of those, I was doing plan reviews, trying to do a plan review at 8, 9, 10 o'clock at night, you know, while they were gonna show up the next morning, and then Hooky Dookie and his wagon trailer thing broke down in Washington, and I sat up there for 6 hours waiting for him, so, I mean, you know, give me a break and stuff, so.
So is this per food service person? Like if you have,
The top part of it is there, and then large group event fees is the 5 and 6 down there, so. And the one thing I tried to do with the fee is really make a dichotomy between whether you're owning the property or you don't own the property, because that's one thing that Nate and others said, that, you know, if they're gonna put on things at their site up at the Silver Dollar up there and that out there, if they, you know, if they repeated the same type of event 2 or 3 times a year with almost identical setups, other than the food is gonna apply every time, that they would just have to pay for an additional, you know, low fee on that to say, okay, you're doing the same thing as you did before, your previous permit applies to that, and as long as you accomplish those things that's outlined in your permit, then you're good to go, and they wouldn't have to pay a $300 a large group event fee for each time they put on an event like that. And so, a little more incentive for those guys to put on things and keep control of it, because the Pirate Party was a total, they contracted with Lincoln et al.'s and said, we're renting this whole area of space from you, and the Lincolns just backed off. And that really created a problem in that when they backed off, they really did not have a potable water source then. They did not really get that accomplished up there and stuff. So that's what's transpired today. I just,
So, on the water, why didn't they have? Because don't they have a well there?
what
Or
do,
did they not give them access to the
They
well?
didn't give them access to the well.
I see.
They said,
You're
guys,
on your own and-
you guys go find a water source, and there are several tanker trucks in the county, but none of them that I'm aware of are certified under the public drinking water standards of 37.5 something that can actually transport and dispense potable water. You have to be certified by the state, and you have to disinfect your truck, and you have to have a source that's certified. We have people that transport water around, but they're not certified.
Now, in the large group of events, are you going to put in there some, either an exception for, or just make it so it would apply to events that are out of doors or somewhere that isn't set up for it? Like, let's say if you had a group, 200 doing something at the high school. It's set up for large groups and has all of that already. Would they have to get this?
I wouldn't, that wasn't the intent to do that,
Okay.
so. And that would be an easy fix, I mean.
Yeah, it would just
For those
be
events that
exceptions in
have
there.
fixed facilities and stuff, I mean, that's what it's implying, is that
Right.
you don't have those facilities available to you. But clarifying that.
This wouldn't affect like the flea market or anything like that then, or?
Well, it
would
might.
it?
I think it should apply to the flea market because I get this as food services and chasing them around.
Yeah, I can see the food service part.
And then-
But I think the park needs to get together and say, you know, how many events are we gonna have out there? You know, the park board needs to be the sponsor of this, so they can have the flea circus, they can have the softball tournament, they can have this, they can have whatever, so. Because we've not been able to, I have not been able to get a handle on 2 or 3 of those other events out there. You know, I've implied to people that they should be, you know, it's like, what 503C is it under, and they mumble and, oh, somebody doing it, so. I think if we formalize this and put it in there, then it's gonna give me the authority to go to them and say, look, we have this rule and you need to comply with it. So-
Well, isn't the flea market under the community council? I believe so. I mean, it always has been.
It's not really a park board, it's the community council.
Right.
Especially
That
if
sponsors
they have
flea
a
market.
year
And then
permit
we use
and
the park.
just use the same rules.
Is there a board for the park?
Yeah.
That's what the,
Yeah,
that's
Yeah,
what the bottom
Steve
line
Young's
is.
on it.
You know, if the landowner, the
Think
park
about
board
it.
takes it out, then whatever events you wanna have out there.
Do you have an estimate of how often this is going to occur based upon past history? So you're gonna have like 50 different events in Mineral County over 1 year, or 25, or 10, or 5, you know? How much workload is that gonna put on you, I guess, and
Well, the workload is there. I've already, you know, we've got 2 event centers right now. We have one on the north side of St. Regis, and we have one at the Silver Dollar Enterprise up there, so those are established, they're there. And it's just formalizing something that, you know, and at least Silver Dollar is very much in agreement with, let's get all this stuff figured out. Especially when they don't want any exposure more than they have to if they just rent out the whole site. And that's, it already sounds like the pirate party for next year is on for the Borgias or Hoggins. And they admitted that those people dropped the ball big time. They did not cover their bases and stuff. And it was really unfortunate because the fires started up one day into it.
Yeah.
Whenever they had the pirate party, the big fire blew up because he literally went up and took 50 of his porta potties and pulled them off and took them to the fire. So, if that's the case, then maybe they need to have a plan B and stuff.
I just have a couple of, I just glanced at these documents, a couple of wordsmithing things.
Okay, it hasn't been more.
Okay, so you're okay with, you'll pick them up on your own
Yeah.
then? Okay, all right.
I know there's a number of them in
There,
there.
yeah, there's one thing, you know, the first one has like, Rule 1, groups exceeding 200 individuals. Okay, that was in this event rules. And then over here in a different area, it talks about, I think it's back here on page 4. This just is a matter of now, the numbers. Under definitions, group function means 1,000, and you got parentheses, 500, or more persons simultaneously gathered in a common area. So,
That's the Missoula format, I'm just.
so this is just plagiarized, fresh out of the book. So
I'm gonna
you'll,
try to go away from that amount and complication if they put it
Okay.
Okay.
So, I think that's all for that.
All right. Any comments? Okay. Next item on the agenda is Flat Creek 5-year review process follow-up. Tim Reed.
Well, they did the interviews, they met with people, they were here, and then they turned around and said, well, we got an early start, so you really won't see anything until sometime after the first of the year. I mean, I thought they were all here because we're going for it and stuff, and so now they've changed time schedules and are gonna take more or less their time and get it finished. I think they're mandated to get it finished by the end of the next federal fiscal year, which would be next September 30th, so I guess they have time. So, I just thought that we were gonna have some kind of preliminary feedback from them that, you know, the process went well, we were fairly in compliance, or boy, the whole process oops done a couple places and this is what we need to work on, so don't really have that. But just as a sidelight though, my 3-year term long prediction for the repository up there came to fruition evident. I visited with them last week and I asked where the portion of the repository was for OU1 when we discovered some waste down here, and they go, don't know, we filled it all up. Side to side, top to bottom, whatever. It has 4 feet of cap on it, so good luck with that. And I said, wow, that's going to be interesting. And he goes, I guess you can put it over there, and it's a place outside the repository, so I'm not quite sure what and where and what connotation that has, but it's interesting because the Forest Service has to develop something. So when the Forest Service gets their mini repository set up, then we'll try to facilitate something where we'll have some kind of open cell or something up there that we can dump waste in. But I think it's going to be a big debate. The first fence that was put up there was, I don't know what Yahoo crew built that fence, but they were not fence builders, I know that, so. But they hired a professional outfit out of Missoula that come and put the new fence up there, and there's a fence around that repository now. Except, I think they made a good move, and they didn't fence the whole side of it, because that's where all of the elk would come down and tear the fence out anyway after they plant it next spring, so I think that was a little forward sighting. But the hill climb spot and everything else, that's pretty well been dismantled because they covered it up and took it out and stuff, so I won't do that. But the other really little interesting development was that they took that steel pipe out above the ground up there and cut it into sections, and thought that they had so many thousands of dollars worth of steel pipe to take to the recycler, and whether the recycler was that adept or whatever, but he has standard language and he says, you know, we don't accept things that might be asbestos. But the crew chief up there on the job, he says, you know, that looks just like that same pipe we took out of what's an ever job that we did, and dang, that stuff wasn't asbestos wrapped. Anyway, they sampled that pipe up there and it had asbestos greater than 10%. So instead of turning into a couple $1,000s recycling, it turned into multi-thousands dollars of waste that had to be double wrapped and labeled and sent off to the landfill in Missoula and stuff. So good old Superior really got the sweetheart deal there, because they ever came to needing to replace that whole section of pipe, however many hundreds of feet that would have been a big bill to get rid of that. So, and this is going to be interesting because now MCC says, hey, you didn't tell us that we were taking out asbestos pipe, and DEQ goes, Yeah, we didn't, so they're saying each other needs to pay, and that's a contingency. But then they all got together and stomped around the mud up there and said, nah, we'll make the Forest Service pay. So it's like, good luck with that one, we'll see. So we're gonna see the mini funding battle again and see who has to pay for the disposal of the pipe. But I'll ask him one of these days how much it was. I'm gonna be curious about that.
What's the depository, what's it constitute anyway? Is it a large hole?
13 acres. 13 acres of 35 feet deep of material that has been collected here, there, and everywhere. And
All right.
stuffed in the hole. They had another change order. I don't know if we'll ever find out. The Montana Civil Contractors bid the job at 1.6 million, and I know they ate up all of that, but I don't know if they're going to get any overages because I don't know if anybody's ever seen one, but they make these absolutely huge tub grinders that, I mean, they can take anything and everything. And I've got some pictures of it, but I mean, the thing sits about 15 feet high and about 30 feet long, and you throw it in there and it grinds it up. And so the tree roots and different materials that they were pulling out there to do the remediation had enough contamination on them that they had to shred all of that and put it on the top of the pile and compact it and stuff. So
Oh, really?
it added about 2 feet of lift to that repository that they didn't plan on.
So is the groundwater, I mean, the drainage part of that, is it pretty well protected as far as getting into
They
water
put a-
supply?
They put a foot of gravel and they put a foot of pretty fine soil material, and they put 4 feet of the material that came from the Jensen Ranch on top of that, so for the cap and stuff. So it would really, in my opinion, be hard for water to even penetrate that. There might be some go down that, but I don't think there's ever going to be enough that goes through there.
Is it Flat Creek drainage? Or, okay.
It's probably 300 feet from the Flat Creek. When the EPA decided to build the repository, and were asking for my comments, I said, good, do test wells. And they did put in 3 test wells up there. So they finished them, maybe, they went down to where they hit a little bit of water and then they stopped. So whether those test wells have water in them, you'd have to pop the cap and find it. But I'm hoping that the EPA will follow up, and we've tested the wells once, but we've never followed up testing. But it would be good now to get another round of testing on those wells. So that's kind of all for that one thing.
All right. Public comment. Do we have any public comment? No public comment. New business then. Center for Disease Control and Prevention, CDC, report for Mineral County. Jen Donovan.
So I'm following up on a report that the CDC put out. They released it to the Department of Health and Human Services in March of 2016, and then they sent it to the county in August 2016. So Peggy may have brought this to your attention. I'm not sure. I just kind of wanted to revisit it, make you aware of it. So what it's called is an HIV and hepatitis C outbreak vulnerability assessment. Is this ringing a bell at all?
Mm-hmm.
Okay.
We just, at the human resource meeting,
Okay.
we got a copy of how vulnerable Mineral County is.
Right, and so it was brought up recently that it was discussed at that meeting, and so we were thinking, we better revisit it. So I wanted to make you all aware of what the report was, what we've done so far, and DPHHS's opinion on it. So basically, they did this study to identify, based upon national indicators, counties in the United States that might be particularly vulnerable to outbreaks of HIV and hepatitis C in those people who inject drugs. Okay, so they identified 220 counties across the country. And it doesn't mean that it's inevitable, it doesn't mean it's gonna happen. It just means that you kind of need to be on alert for it. And so when the Department of Health and Human Services got this report, they did a lot of research into it. And Jim Murphy, he's the bureau chief for the communicable disease section at the Department of Human Services. He said that when they got the report, he and the state medical officer, they really dug into it and determined that it was not actionable information beyond what everybody should be doing anyway. So they couldn't figure out how, there were 2 Montana counties, Mineral and Treasure, who ended up on this list, and they still to this day can't figure out why we're on the list. And so, I know, that's really how he felt about it. And so I think what Peggy had done is she sent out an email to our key surveillance partners. So what we do is we kind of touch base regularly with medical providers, mental health, substance abuse, the hospital, and then our clinics on a regular basis to find out, are you finding any trends of anything? Are you seeing, higher cases of flu or whatever? And she even sent it to law enforcement to see if you're making more drug-related arrests of people who inject drugs. And nothing came up at the time. Nobody was like, yeah, huh. So I think that bottom line is we know we probably do have a population who are injecting drugs, and it is a concern, and it's on my radar as definitely a worry, and we should do something about it. I don't know what at this point, but I knew that it came up at the Human Resource Council, so I wanted to make sure that you guys had heard about it and kind of knew where the state stood on it at this point in time, in case it comes up in general conversation. So what we're planning on doing is just kind of increasing that surveillance with all those groups that I mentioned to see if anything is coming up, and then make a plan in the event that something does happen. We have no confirmed HIV cases. We've had 2 rule-out cases that we've dealt with, and 10 hepatitis C cases since August, since we met. But all of those hepatitis C cases are old cases, so they contracted it sometime in the past. None of them are acute, so that means that they're not getting infected right now because of drug use. So,
And they said at the Human Resource meeting that they took counties that, the population of the counties, because we're low income, that stuff was factors in it, where, they don't look at like Missoula County and the bigger county. I mean, it was kind of shocking to see a picture of the United States and there's no red dots in Idaho, Washington, states that you would think, and here's a little red dot in Mineral County and a little red dot over here, and it's like, whoa, but then, they were talking about they didn't take in, consider, I mean, New York didn't even have any, there was no red in New York at all, so, but that's what they said, that they took low population counties with low income, and that's what they looked at.
There was no reported incidences then.
What's that?
The data did not support any reported incidences at all.
No.
Okay.
No, not at this point. So I think they also looked at like opioid prescription rates and possibly ER visits or something like that. And when you're a small county, data gets skewed because one case is a huge percentage, and
Kind of like the unemployment rate. I mean,
Exactly.
10 jobs is a big deal.
So I think the bottom line is, I think injectable drug use happens everywhere. I think it's something we should be all focusing on. We haven't seen anything to be particularly alarmed at this point, but I just wanted to make sure you guys were aware of that report, and that the state really doesn't feel like there's much validation to it. So he and Peggy, Jim Murphy and Peggy, Jim Murphy being the Department of Health and Human Services guy, and Peggy had chatted back in summer of 2016, and then I touched base with him again in October this year, and he had the same story. He said, unless you're finding something on the local level that would give us more reason to be worried. We're really not worried right now. We're still scratching our heads about how we ended up on the list. So, I mean, St. Regis School is working on putting into place a drug testing protocol for their students, and we already have that in place in Superior and Alberton, so I think that's good. And so I guess my ask would be, if anybody hears anything that's concerning, just let us know so we can be communicating that to the Department of Health and Human Services, because they have epidemiologists and people who are really smart and really good at this stuff to figure out if we should be doing something different. Okay.
All right. Thank you.
Yeah.
Okay. 2018 cooperative agreement between Montana Department of Public Health and Human Services and Board of Health signing.
I'm glad this is for next year. Optimistically, we probably could, if we could, myself and I, and Lint in my pocket could fulfill this contract. Unless Candace comes up with a new incentive invigorating methodology to get me going and off the thing. I'm not sure we're going to get it done this year, but that's another point in time. So this is a standard contract. I know last year that they talked about this peer training thing, and that appears to be the only addition to this contract that you're willing to do peer county training. So they could call me up and say, hey, old guy, you've been around a long time. Could you go over to such and such county and train the newbie and go to work with him and stuff? I'm not sure the validity of that and stuff, because that can give him some pretty biased information. But anyway, that was seemed to be an addition to this contract. Other than that, we were refusing to do any body art. I don't care how any way you cut it. I'm not never going to inspect one of those places now. I did my one time, and I'm so glad it burned down.
Burned part way down.
Yeah, he's out of business.
Yeah.
So anyway, this is a pretty straightforward contract again. We might be, very likely we're gonna have to slip under the 90%. If you do 90% of the inspections, I'll still give you full reimbursement. To think that I'm gonna get 100% of the inspections this year is just not gonna happen. It's
This is an annual,
annual contract.
yeah.
Do we need a motion to approve this, Tim?
Yes, please. Motion for the chairman of the board to sign the annual contract.
Do I have a motion for the chairman of the board to sign the cooperative agreement between Montana Department of Public Health and Human Services and the Mineral County Board of Health?
So moved.
We have a motion. Do I have a second?
Second.
All right. All those in favor?
Aye.
Aye. Opposed? Motion carried. Okay. Eight?
Eight.
There you go, sir. Thank you.
What did I sign the other day that the assistant's be using? Signed something.
Yeah.
It's interesting. Got a sign off on something the other day.
You had to keep one and whatever.
It sounds like census, they send you the pen to sign it with.
Oh, really?
Yeah, you have to sign it with this pen.
All right, the next item on the agenda is to set the next meeting date.
We need to get a new calendar.
It's kind of running.
It's better. I want to go to Texas in February. There's a P3C conference down there. I can't believe the people that end up showing up. It's this worldwide, their architecture, their manipulators, they're group people, they're doing all these things. It's just incredible, so I'd really like to go to that conference. It only costs $500 to get in the door, and about $500 to fly down there and stuff, so. Anybody, anytime since the last week of February and stuff, I doubt that you would allow me to go to that, so. Typically, we try to shoot for the middle of the month, and Fridays, I don't know why you wouldn't be here 2nd, 9th, 16th, or 23rd, so. Maybe the 16th of February?
I won't be here.
Hmm?
I says, I won't be here.
When will you be?
January and then after
What,
in March.
what country are you gonna be in?
Costa Rica.
Oh.
Huh? So, can we
should be.
have a
What
Board
date
of
the
Health
conference?
meeting in Costa Rica?
Sure, come on down.
January or?
We would.
Oh, okay.
Bill will be here pretty much mid-January, and then after the end of March, we're good. So, or the end of February into March.
March, you'll be back.
So the 16th, 23rd of March?
23rd would be good.
Kind of at the end of the quarter, but that would please me more, because it'll give me a little more time to work on that group event. Okay.
Alright.
Tentatively 23rd of March, then.
All right.
At 10.
I have a quick question. What kind of information do you guys want from me? Do you just want updates on these special issues? Do you want kind of like a standard report from the health department or what we're doing? Or I guess I'm just still trying to figure out my role on the Board of Health and whatnot.
Do you compile data on incidences of infectious diseases such as flu and other TB and whatever other infectious diseases that occur in the county?
Mm-hmm.
Are they reported like on a monthly basis to someone or quarterly, or how do you compile those data?
We keep track at the health department. We have a log of all the different cases that we have. Reporting to DPHHS, every disease has a different reporting time frame, but yes, I have what I give these guys on a monthly basis if I show up to the meeting is a report of the counts of all the different diseases that we have for that time
Yeah.
period. So I'm happy to
Yeah,
share that.
that one, if it's already being done,
Yeah.
and
Mhm.
I'd like to see that continued.
Okay.
Yeah.
Absolutely. The other thing I was brainstorming would be like Department of Health and Human Service press releases or, I don't know, trends in what's going on statewide or, I don't know. I was just brainstorming. So if something comes up and you're like, yeah, I'd be interested in hearing about that, just shoot me an email.
Yeah. Shoot us an email.
Okay. Or shoot me an email.
You guys like to see anything else?
She keeps us pretty well updated.
For the future, I was thinking if we were to pursue any other funding, and programmatic type things, I was thinking we should really kind of focus that on our needs assessment that our county has done and really target those areas that have been shown to be our health needs that are being concerned. So that's just kind of the things I've been rolling around with the future of the health department and the future of public health in Monroe County.
That county assessment you referred, how often is that like redone or updated? Or?
I think every 4 years. We did it in April 2016.
Mhm.
So we're right in the middle of it
Is that
right now.
separate from like regular census, or do they kind of use some of that same numbers? Does it coincide with the census they do every 10 years?
I don't think so. No, it was run through the Department of Health and Human Services. We have a grant called the Public Health Systems Improvement. And in our Healthy Communities Coalition, we talk about it quite a bit. And they did a study, door-to-door
Mhm. Oh.
questionnaire type thing. And so the Department of Health and Human Services has a program where COP works with an agency who randomly selects a group of homes from all these different
Mhm.
places across Mineral County, and then they went door to door and asked them.
In the community health assessment, I think there was like priorities that were listed in tops, I think were something like alcohol and drug abuse and and then smoking and obesity. And I don't know, is there some effort being made in those top priorities
Yes.
already?
Yep, and our Healthy Communities Coalition, we really are trying to, right now actually, we're trying to figure out how best to break down the actions that are happening across the county among multiple agencies
That would be
in
good.
each of those areas.
If we could get some kind of
Okay.
an update about what is occurring in those high priority areas, that would really be good.
That would be good.
Okay.
I agree. Cool.
DPHHS, did they send any quick summaries about the recent budget reductions? Did they send anything out for impacts for counties and stuff? On our side of the thing, it didn't seem like there was going to be any impacts that they did lose people, they didn't lose things.
Yeah, I don't know if there's been any final things. There's been a lot of, this may happen, and if this may happen, then this group might be impacted this way. I don't know of any final reports, but we do have a lead local call next week, I think, so I'm sure that they'll be telling us something during that call. All right, thank you.
All right, thank you. Anything else? Do we have a motion to adjourn?
Also moved.
I'll second it.
All right, we have a motion and a second to adjourn. Rather hastily there. All those in favor say aye.
Aye.
Aye. Motion carried.
Thank you all.
Thank you.
We gotta be a little more efficient what we're doing, because right now we're spending too much money on fuel. So if they get in the habit of doing that, it'd probably be a better idea, unless
Okay.
you guys think differently.
So they'll turn them down on Friday to
Right.
62.
And then
And when you come in,
I'll turn them back up, so when they get in here, it'll be nice.
It'll be nice.
what hour of the day will you be probably turning them back up?
Sooner they get here.
What that time is for the email memo?
Between 7:30 and 7:45,
Okay,
and they all know when I'm here.
okay.
Okay.
And it
Okay.
doesn't take long. Those supply lines heat those heat registers up
Okay.
quick. You know. So are we good with that? You okay with that?
Yep, sounds good.
Okay. Thank you.
Thank you.
Till we hear complaints, I guess, and then.
No, well, I mean, it
No, but I
only
mean,
makes sense.
if they come in and say, well, our rooms aren't warm enough when we come in, or,
You know,
I
it
mean,
takes
we'll
20
just.
minutes, a half hour to get that thing just blazing.
Yeah.
Okay, good. I think for the most part they'll be pretty much okay with it. So it's just the weekend.
All right, so as you all know, Idaho Forest Group has taken over Tricon. Our first day was Monday with Idaho Forest Group. And they are all about safety, and they're all about teamwork. And so in regards to that, everybody's assigned job, and my job is no different. And what they are requesting is to bring before you, is there any possibility of changing our meeting time so that, to accommodate where I can do my full day shift and still do commissioners. My shift officially ends at 2:30. So is there any way we can work around having me at work and doing this job at the same time?
So it'd have to be a time change, not a day of the week change.
Well,
Couldn't work.
however,
Yeah. Because they want you to be there Monday through Friday till
Right.
2:30 every day.
right.
So that'd leave 2.5 hours of a normal, well, you probably wouldn't be able to get here till 3, so that'd be like 2 hours of a normal business day you'd be able to be if we were 9 to 5 like now.
Right. So I had my wife brainstorming also, and she suggested to ask you, maybe, what'd they do with of splitting and doing, I thought I wrote it down someplace, I might have lost it already. Splitting the days, doing 2 later afternoon meetings, like from 3 o'clock to whatever we figured was, do 4 hours. Do 4 hours twice. I don't know if that's something that. So I told him I would run it by you.
Yeah, I'm just trying to think how it would work with,
Well, it's just, yeah, it's just so many times we need Ella,
Yeah,
Ellen,
yeah, and I
Tim,
understand that.
public comment, so I guess we have to digest it. Maybe we'll have to see what everybody else thinks too. I mean, it'd be one thing to say, yeah, I could be here till 6:30 or whatever, but then that might not be fair to not let Tim or Ellen or Casey or whoever else is
Yeah,
involved.
that's why I'm putting it out there.
Yeah.
I guess maybe put it on the agenda and get what
Mhm.
the elected officials think and
Mhm.
public or,
Yeah.
We've talked about evening meetings before, we've had requests, and then
And then nobody shows up.
Then nobody shows up too. So I don't know what the
Yeah.
solution will be.
Well, yeah, maybe we'll have to do that. Maybe we'll, now that we've been notified by Mr. Simon, we'll probably have to put it on the agenda so that everybody can help us make an intelligent decision on how to work with that, work within that, or too bad they wouldn't still at least give you one dedicated day. We could easily move it to a Wednesday or a Monday or whatever.
well, yeah.
Yeah, and I don't think that the day the Friday is a problem. I mean, it's just part of, if I'm not there, then say we got 2 guys out in the yard sorting logs, and we're feeding the mill different now than what we were before. So you pull one of those guys out and put them up there to do my job, for the whole day, then that kind of puts more pressure on the other guy that's out there. They've got them staggered right now.
What about the other way, Dwayne? Because normally at like 2:30, we're kind of winding down, and me and Lori usually just kind of stick around and sign checks. But so would you be able to switch a shift so that you're going to work at 2:30 or 3 instead of getting off? So
No,
you could-
they're not doing anything other than maintenance.
Oh, they don't have a night shift or something?
No, and they don't figure on, we did have that discussion the other day too, they don't figure, right now, they don't figure on a night shift for probably at least 2 years.
Oh,
Because they've got they had a checklist of 300 safety issues that
They had to address.
that they're working on right now. And they are addressing, and I'll tell you, every day, there's a meeting at 5:30 in the morning. Usually the mill starts at 5:30. Well, now we're doing a safety orientation in the morning at 5:30 for 15-20 minutes, and it's safety. And at the end of the day, there's a 15-minute meeting, and we address things that happened that day. And I'll tell you, people are really paying attention. They're doing the changes that they're saying they're doing. They told us when we started on Monday, if that mill shuts down for a little bit, you guys try and stay busy, do whatever you can do. And we're going back to work, when we're done with whatever we're doing. And they've really been concentrating on locking things out, and because that's been a big part of their safety issues, is whether you go in and start to work on something, is there any chance of stored energy activating something and somebody getting hurt because of that? And they're really, really constant. They've moved in a brand new break room that's like a triple modular fantastic. And I mean, they bought all new pickups for the foresters. One of them's got a
So
snowplow.
who's in charge of the forestry part of it now, or?
It's a guy from over, the head
Oh.
forester is a guy from over in Idaho,
Oh,
yeah.
uh-huh.
As far as I know, he was there the other day and I didn't really catch what he
So
did.
what's Angelo's title then?
I think he's still a forester.
Oh, he's
You know,
just a forester?
Yeah. You know, he may be the guy in charge of this. I
Oh,
didn't really.
but he has
was-
somebody over him
Yeah,
or
yeah,
whatever.
yeah.
Well, Casey, next Friday, what's going on in the afternoon? Like, 'cause if we have Dwayne's issue on, we'll probably better put it in the afternoon so you can be here, because I take it next Friday, you can't be off.
I mean, you know, they said, try and work it out.
Uh-huh.
We'll work with you for the next, you know, I told them usually we didn't change meeting dates until the first of the year.
Right.
So, you know, I think they'll work with me over the next few weeks,
Oh, okay.
but
So it doesn't have, if we have it to talk about with other folks next Friday, it
would
could
be,
be.
yeah,
anytime.
I think that would be
Oh.
acceptable.
What time of the day is open?
Nothing. So we have the lawn statute decision and then interviews scheduled after that.
Oh, what about the morning? Anything open in the morning?
We have a
Weed board appointment.
and Sherlock Avenue extension for partial abandonment.
What time are each of those?
9 and 10.
And then 10.
Oh, well, the weed board thing will be quick. That'll probably take 3.5 minutes.
So 9:30.
How about 9:15?
9:15.
Yeah, the weed board at 9, and then Dwayne's issue at 9:15, and then 10 is
To
the.
10. Friday works for me as far as, because I have like human resource meetings on Monday,
Mhm.
coalition on Tuesday,
Right.
usually like the healthy community on Wednesday, you
Mhm.
know. Thursday I have human resource, I mean, it's,
And mine are usually Wednesdays or Thursdays.
Yeah.
I come around.
and then I usually come in like on or whenever I've been coming in and reviewing payroll before Casey prints the checks out, in case there's
Anything.
any discrepancies, so that she doesn't have to go back, and if there is an issue, go back and void checks, and it's just a lot easier to come in ahead of time and review payroll for.
So, how do we want that title, Dwayne? You're on the agenda at 9:15. What's a good thing for her to list it as? Commissioner Simon's
Schedule review or something? I don't know.
work schedule conflict, or discussion, or decision, or possible action? I don't know.
Discussion of commissioner meeting time, date. I don't know.
Mhm. What's it sound like now? Have you typed anything?
Well, I could do it Simon's work schedule review conflict, or I could just say commissioner agenda meeting date time change.
What do you think, Casey?
Either way,
It's informative enough to the public when they read it?
No, I mean, what do you think about changing it?
Mm.
for like my personal
Mhm.
stuff, it would suck.
What?
Yeah.
Yeah, I didn't I didn't know what to tell him for sure. I said, well, I would bring it up and
We could live stream you from your
there you go.
machine.
I can't have a phone.
Oh. What about one of those GoPros?
We don't want to see him nodding off in the loader, snoring.
This
away.
new job, there's no nodding off. No, it's, so we're feeding both the log decks lorry with wheel loader. And
Oh.
my job is to keep everything straight and between the two of them.
I would put maybe Commissioner Simon work schedule discussion.
Yeah.
Work schedule?
Discussion, yeah.
Okay.
Yeah, I don't know what to. Oh, and the other thing, Roman, along those lines, I guess I just will put that out there too. Glenn McGarrett called me, and I haven't been to a aging council meeting apparently in 2 years. They're quarterly, and they're wondering what to do about that, if there was any other commissioner interested in the aging council. And I said, I couldn't tell you. You know, both times that there was a quarterly meeting coming up that I was gonna go to, I was on nights, and they changed the damn schedule just
Oh.
before the quarterly meeting, and then I couldn't. You know.
I could take your spot.
Could you?
Yeah.
Okay. You sure?
Yeah, oh yeah.
Talk about dozing off.
What's that?
They have really good lunch up there.
Oh.
Yeah, yeah. They had
So-
it down here one time I went and,
They
They
meet
did
at the Tucknuck or whatever usually.
Oh, yeah.
Usually
Okay.
they do.
So, I guess we'll just let Glenn McGarrett know, add me then, or?
Okay. Okay, and I'll find out.
And then-
I think the next one is in, I think the last one was August.
Mhm. Coming up
So,
in January,
so
probably.
there was one in November,
Oh,
January, February. Yeah, I'd have to check and see what
Okay.
the date of the next one is, but I will.
Lincoln Systems of Care, Amy Lommen.
Yes, so I'm Amy Lommen, and this is Jess Mayer. You had a Jess Mauer.
Yeah, Alberton, yeah.
Yeah, she has my.
Oh, she does?
Yes. She's a growing dentist.
Who gets the bill?
Well, I got her bill and she got mine. And it was so funny, we only realized it when we were at the Alberton School Board and she was sitting in front of me and all of a sudden there was this moment of realization and it's, oh, it's you! But I am Jess Mavers, so yeah, yes. I realized I don't say her last name very much. So we are here representing the Linking Systems of Care project, and we have been working with all kinds of people and organizations in Mineral County. And after speaking with Ellen, she's like, "Have you guys talked to the commissioners yet?" And we're like, "Yep, we'll do that." so we're here basically to just tell you guys what we're up to in Mineral County, and then give you guys the opportunity to ask us any questions that you want. So I'm here, this might be a bit confusing, I'm here with two different hats on at the same time. So one, as you guys might know, I work for the health department here in Mineral County, and my job was writing the community health improvement plan, but then also helping kind of implement what those plans are and were. And one of them was addressing child abuse and neglect. So my other hat, my full-time gig is as a researcher at the university. And we work on a project that addresses child abuse and neglect. And so after a while, kind of keeping these two things very separate, it was like, well, hey, this might answer part of this, so let's start talking and see what we can do. And so what that project is, we are funded, it's called Vision 21. It's part of that initiative that's out of the National Institute of Justice, and the branch under that is Office for Victims of Crime. So I've already confused myself, so don't worry if you're like, what? So anyway, our funder is the Office for Victims of Crime. And what they have asked us to do, we're a demonstration project, so nobody else has done what they're asking us to do. They basically just said, like, good luck, let us know how it works out. We have been tasked with trying to link all of the systems of care in Montana together. And so what that means, a system of care can be mental health, it can be medical, it can be juvenile justice, what am I forgetting? There's so many different systems. Education is one of those systems. So what they are hoping we can do is kind of get all of those talking on the same playing field, which didn't sound as hard as it actually is. In the beginning, we're like, whoa, okay, this actually is rocket science. And what they're trying to get us to link those systems with is in
providing services to youth and children who have been victimized. And so I'm using the word trauma, abuse, neglect. Really what that is victimization. So here we find ourselves. We've done 3 years of work so far, which was literature reviews, it was focus groups, it was surveys, it was a lot of data collection where we were trying to kind of get the pulse of what it looks like in Montana to be a service provider who is providing services to these youth. So then we have been tasked with, am I forgetting huge pieces yet?
No, I think you
Okay.
got the basics.
Okay,
Like enough
so-
for the Cliff's Notes version.
Good,
Sure.
good, Cliff Notes. So one of the things that we found out when in doing all of this kind of research with service providers is that there's a lot of inconsistency with screening instruments. And so what a screening instrument is really identifying a problem. It's not treating a problem, it's not, there's another word too, but screening is really identification. And so what we found is that a lot of service providers across Montana are using screening instruments and assessment instruments, which are diagnostic tools, vice versa. And we found out that there is a want and there is a need for some type of universal, I hesitate to use universal, but a universal tool that can be used to identify victimization, but from different systems of care. So not only a tool that's developed specifically for mental health, but so that education could use it, so medical doctors could use it, juvenile justice can use it, and so on. So that's what we've been tasked with, that's what we've been doing the whole last year, is building the screening tool. So now we have the screening tool, and we have to start the part of the project which is piloting this screening tool. And so this is where both of my jobs married, which is really nice. So what we have, right now we have the Mineral County Health Department that has signed on and agreed to start with this first pilot phase. And then I'm gonna let Jess, if that's okay with you, kind of talk about navigating Mineral County and who we're talking with.
Yeah, I'm happy to take it from here. So I want to say also that, so this is a two-pronged project primarily, and one of those prongs is the applied component where we're directing kids who are basically have a red flag pop up as a result of the screener to services. And so that's largely what we're talking about today, is this applied component where we're going to use the screening instrument, which we'll provide to you folks in a variety of circumstances, whether it be hopefully schools. We've been talking to the schools about using the screener, but that's a whole lot of conversations involved with that. So we've been wooing the schools to use the screener, and also the Mineral County Health Department will be using the screener with the WIC program, for example, and also the home visiting program. And so ideally what we'll be doing is, kids who show that they have signs of need or that they have been victimized, is we'll be directing them to mental health services. And so the idea is to catch kids early when they are struggling with these problems to offset challenges down the line that cost to them, and also, our shared taxpayer coffers a lot of money, right? So there's the applied side, and also we're doing research as well, and that's where, our employer, the University of Montana, is involved in this, and that we're going to be taking the findings from the screener to identify the presence of victimization and trauma in various communities across the state. And so here in Mineral County, what we've been doing is, fortunately Amy had an in with the Mineral County Health Department, and those folks have been very much enthusiastic about using the screener. We've also spent, as I said, a lot of time talking to the school districts about how best to go forward, what kind of criteria do we need to satisfy, what does FERPA look like, stuff that I don't necessarily want to bog down this conversation with. But we're hoping to roll out our screener with all of the school districts in Mineral County within the next year. That's our hope. It remains to be seen if that'll be happening. We've had several conversations with Ellen Donahue at this point because of her representation of the Mineral County Health Department, and that's where you folks come in, as you're involved with this too, just by the nature of your jobs here. So, and Ellen has been very helpful, and she's been supportive of the project. She wanted us to come to you and at least, tell you what was going on, so we weren't leaving anyone out of the loop. We've also had conversations, it feels like with so many people, but lots of them lately have been focused on the schools. You know, I've been spending a lot of time with Carol Young from St. Regis on the school board out there. And we're hearing things from the school board like, you know we have problems, what are you going to do about it kind of thing, like screening's great, but then what? So we're trying to help with that too, and in that vein, we've developed a referral matrix and tracked down services locally and also in Missoula. And I know that's not optimal to get folks out to Missoula, but we have many offerings of services that are available, which every time I actually turn over another rock, I do find another service out here. There's a contractor that works with Child and Family Services, Evolution Services, I think they're called, and of course the Partnership Health Center here, and there's a 1-800 hotline, of course, which I'm guessing you folks are familiar with, and I've had conversations with a variety of people. So in the end, it does begin to link the systems, and our screener is in many ways a vehicle for linking those systems as well. You know, we hear oftentimes from people who work with kids that they work in silos, and the problem with that is it's not very efficient because nobody's communicating. And so we're trying to eliminate those silos to increase communication and help kids who need services, basically. So that's kind of our pitch. You know, we're not asking anything of you today. We just wanted to introduce ourselves and let you know that we're here and answer any questions that you might have. And so I don't need to keep talking necessarily, but if you folks have questions, we're happy to answer them.
Is there one person who does the screening, or are you just different person in their different role,
So-
wherever it may be?
That's a great question. That's part of why the health department is involved, because it'll be employees of the health department that would be the screeners.
Okay.
For multiple reasons, but for one, because they meet the requirements for the health background. We will also do extensive training with them as well for any gap, that there is with that. But I think there's a few people that are eligible. So the nurses are eligible. Carissa Cool is eligible, and I am also eligible to be a screener. So
Is it mainly a medical eligibility or a mental health eligibility?
it's how did you describe it?
It's more of an employment status eligibility, the way we're thinking about it in Mineral County, especially as it relates to the schools, because ideally we'll have a third-party administrator go into the schools, and Mineral County Health Departments specifically have a certain amount of respect, and they also have connections in the community, and they're also legally empowered to do some things that other entities, individuals might not be able to. For example, allow a child 16 years old to consent to screening. That's something that a medical provider could do, but that a layperson could not. And we just like for our pilot launch to have the credibility associated with using the health department. It seems like the safest way to go for starters. Down the line, we will have other people using administering the screener. We have an 8-hour training program, which will be comprised of, for example, training from the Department of Public Health and Human Services on mandatory reporting. So that's like a really big deal, right? So if a kid discloses that they've been abused, then what? So we will have education from the horse's mouth, as it were, on that one. Similarly, we're going to require that people who actually administer our screener will take a human protection subjects training, which is a course offered through the National Institute of Health. We'll also be informing people who do the screening on how to gain consent legally. Consent is a very big deal. We require consent from parents and also assent, as researchers call it, from kids. So in addition to parents saying, okay, this is okay for my kid, the kid has to say it's okay as well. So we have consent forms and such, so everybody's covered. A lot of my job has been focusing on the legalities of what we're doing, and also the policy
coordinator.
So they don't let me talk all the time, because I go off into the weeds and nobody's listening. So if that starts happening, just tell me to be quiet.
I can relate to that.
Yeah.
One thing that I'd like to bring up too, and I think Jess kind of alluded to, is that for us, we see, we have kind of the things that we're supposed to be following with this project. So linking these bigger institutional systems together. But something else that's really important for us too is identifying these resources that are innate in our community. So one group that we're really starting to navigate is the faith-based community. And so we've got some amazing people that serve on our advisory group that are kind of helping me figure out like where you even start with that. And so we realized that there are really valuable resources, you know, spread all throughout our community. And so we're really trying hard to map not only these bigger systems, but also, you know, what our community, and our community being Mineral County, like what we have to offer. And so, yeah, maybe we don't have, you know, substance abuse services, but we've got this group that can provide help. And so we're really working hard. And that's part of, you know, each pilot is going to be getting into that community and really figuring out, you know, what those services are. But then also what the community has to offer as well. So that's a pretty exciting piece, being part of this pilot, but also living here and seeing like, wow, you know, you can read statistics, but then like when you really start thumbing through, you're like, there's a lot, you know, Mineral County has a lot to offer, so, yeah.
Yeah, and the findings, and I probably mentioned this at least briefly, but the findings, though, our data findings could be used to secure additional grants to beef up trauma-informed care here in the community, right? So that's one of the things that we have to offer is the data, which can be helpful for applying for a variety of different types of grants and hopefully continuing to increase trauma-informed care offerings here. And you know, Amy secured a grant recently for the Mineral County Health Department, which is helping to launch this project. But the idea is that we continue to do that, and we continue to make more resources available by way of this project. So it'll continue feeding itself, hopefully. So.
And it's mainly a federal or a state level that you kind of, this work is being done that you guys do?
So we're federally funded,
Okay.
but ours is specific to Montana. We don't have anything else to do, you know, with other states. And so that's been the really nice thing about being a demonstration site. For one, we kind of bang our heads against the wall a lot because we don't have anything to follow, but we're getting to create the wheel as we're going. And so, yeah, everything that we've compiled thus far has been very Montana specific. And so as a researcher, you know, we don't know how many children have actually experienced victimization. We've got national statistics, which are, I want to say roughly 1 in 5. But then you can find other statistics for different populations where it's less than that. And then I've even read some that says 1 in 2 are likely to experience victimization. So it's not only one thing to identify what we're working with, but that can help us figure out how best to really, like Jess said, start helping kids sooner rather than when they make it to adulthood and say, what happened, you know? So hopefully, you know, that's another big push from ours is not only finding out the prevalence, but then also being able to do something about it.
Yeah, derailing some of those long-term costs associated.
Yeah.
I'm not sure if you folks are familiar with the ACEs questionnaire, or the Adverse Childhood Experiences. It's a questionnaire that's used frequently now on adults to find out what kind of a childhood they had. There was a big study done by Kaiser Permanente and the CDC many years ago now, in which they found a direct link between an individual's ACEs score, the number of adverse experiences one had in childhood, and a whole host of adverse outcomes later on: heart disease, liver disease, lung problems. So there's a direct relationship that's been proven between negative experiences in childhood and adverse outcomes later on, which, as stewards of the taxpayer dollar, it's very apparent that this costs money. So the idea is to catch these kids early, to build resilience in them, to give them more protective factors, and also in some instances to help them recover from adverse experiences, so you offset those costs later on down the line. So there's very much a public policy component to it, and while our money comes from the feds, the Office for Victims of Crime, it also goes down through the Montana Board of Crime Control. So this is very much a criminal justice component too. You know, we're thinking about these things in terms of offsetting criminal justice costs down the line as well. So the idea is to save a whole host of negative outcomes and try to make things better early.
So regarding solutions, and back to your challenge question, what are you going to do about it? Do you see
Yeah.
the recent hits to DPHHS and all
Yeah.
those things affecting your ability, once identified, to actually, you're talking about sometimes kids who are abused or whatever, and that kind of seems to be a role, foster care or other kinds of things like that now are kind of being cut.
I
Is it going
hesitate
to
say
interfere with
this.
your program? I mean, you're at the federal
It
level.
changes with administration, so while we might see a dip here, the next
Mhm.
administration might be very supportive of these types of things. I have seen cuts addressing, like potentially directly affecting our program, but our funding still stays the same. It makes how we map out services, you know, the things that we're able to, referral services basically are the ones that we're seeing hit the hardest, if that makes sense.
Yeah, and I can even speak to that on a local perspective. So just this week, I received a letter from Andrea Wershing-Bertelli. I think I'm mangling her name, but she's the behavioral health supervisor for Partnership Health Center, of course, which has an office here. We were asking them to sign a letter of intent, basically, which would have pledged them to talking to our external evaluators about the progress we make and what we're doing. And she said, no, I don't think we can do that right now because of the time involved with talking to your evaluators, because it's an uncertain time right now. She cited the change in their leadership as the primary reason, but I have to imagine that resources also play into that. So certainly it's a factor. We have been told by mental health providers that they do have room to add, space for new kids in their services. So that's where we're at right now, but it is a changing, moving target because they are losing funding, and we have to be very sensitive to that. And there's always the gap kids, which are challenging, the ones who don't get medication, the ones who don't have health insurance. It's that gap that we really have to pay attention to. We have been looking into trying to secure additional resources through grant funding to help provide services. But it's definitely on one of the things we're trying to do. It's one of the pieces we're moving around.
I've never heard it, a moving target, that's so our job. Oh my God.
Yeah.
I better write that down.
Well, you mentioned St. Regis, and now you got Alberton obviously involved. You mentioned Carissa Cool and all that. Have you done much at this local school, or?
We have been talking to Scott Kinney, and he's been very carefully scrutinizing our pitch, which is smart and appropriate. The last conversation I had with him was maybe 2 weeks ago, and he asked us to introduce ourselves during the spring fling, where they feed people, and that would be a non-threatening introduction of our screener. And in the meantime, I'll be working with Bia Kaliba, the school district attorney, to craft solid
Bia, I know
protocols.
Bia.
Yeah, we've had multiple conversations with her as well, and she's been very supportive of the project, and also been helping to guide us through, some of the legalities involved. So the idea, my goal currently is to roll out our screener in the after-school program during the summer. I know you know there's an after-school program during the summer. I didn't, but apparently there is.
It's a 21st century grant that funds not only after school, but then summertime programs.
So yeah, we have.
So that's why they're calling it after school.
Yeah, I mean, Scott was, he's been really wanting us continually to provide more specifics, and I've been working to do that. We don't have him signed on the dotted line yet, but I'm still working on that.
We'll have to tease her from Bia. I've known her since she was this big.
Oh, really?
Kind of grew up together. Her dad and my dad worked together.
Huh, interesting.
Yeah, when her last name was Maloney.
Huh, that's awesome.
So say, Roman says hi, she'll remember.
Okay, yeah, I'll keep that in mind.
Yeah.
Yeah, we had a funny conversation about her when we were in Libby, actually, wooing the Libby folks for the project, and we asked the school district in Libby if they had Bia as their attorney, and they said only when they wanted to win. So I
She's
relayed
pretty
that
sharp,
back to Bia. I was
She's
like,
a sharp cookie.
yeah. Yeah, and so she's been super cool, but a lot of very valid questions that we've had to answer and work through with regard to FERPA and the PPRA and on and on. So
Stuff that I don't know what it is.
yeah, that's when I start losing people.
Well, good. Well, thanks. You guys, you have a question? Mary
Anybody else?
Furlong, you have questions? Kind of sounds like your area.
She's right the
I'm meeting with him later
Oh, okay, all right.
We have some
Stupid me.
we have some materials for you too. In fact, we can leave you a screener. There are two of them, one for ages birth to 8 and then one for 9 to 17. I have the birth to 8 with me.
And so the birth to 8, we're envisioning that parents would take that on behalf of their children. And then the 9 to 17, we envision children actually taking that for themselves. So all of the content is the same, the wording just changes to do you or does your child. So that's kind of the difference. So the screener is broken up into 2 pieces. The top part is experiences. And we've worked with experts, national experts in
Thank you.
in trauma to develop this. And so the experiences, what we learned was that it's best to ask very direct questions. So they are kind of shocking at first, but they were double, triple, and quadruple checked by tons of people. So that's that first section, is asking, has this happened to you? And then that second section is it's really expressions. So think of that as ways that children might outwardly or inwardly feel about experiences that have happened. Those are really pulled from PTSD and depression screeners. So,
And also, that document is just a work in progress still. I'm adjusting some things.
Okay.
yep. And so this one is for, like, this is what we give to pilot organizations. It's very legal. Can I say that?
No, that one's not.
This one isn't? Okay.
It's illegal
I
then?
guess I guess it depends on where you're coming from.
So this is very in-depth, talking about kind of the expectations from our end, but also expectations that we would have of the organization. So it's really kind of a how we work together document. So just so you guys have that. And like Jess said, it is constantly being updated, because as you can imagine, every place that we go has different needs, and so we always try and incorporate those as we learn more and more. But yeah, I'm happy to send the screener to you guys via email if it's something that you'd like.
Yeah.
Oh, that
Okay.
sounds interesting. Wow,
Perfect.
Yeah, we
Okay.
can send more stuff.
Perfect.
Well, thank you guys for taking the time to
Yeah.
come give us
Thanks
your...
for finding time for us.
Yeah,
You
thanks
guys
for
have a
squeezing
lot
us
of
in.
stuff
We
going on.
appreciate it.
And then I'll send an email to you guys, and that way if you have questions that come up, feel free to ask. And if you guys want us to come back and keep you in the loop, we certainly will. Whenever we have new stuff to share, I'll probably get us on the agenda just so we can keep you guys apprised of
Yeah, that'd be
what's
good.
happening. Great.
So I know, Amy, are you an Alberton person?
I live in Missoula. I work for the
Oh.
university.
Oh,
so
okay.
I work for the
She
same.
lives in the zoo.
Yeah,
I see,
same people
okay.
that Amy
Yeah.
works for the criminology research group at the University of Montana.
Yep.
Because the other Jesse's a 9-miler, so I thought maybe you were a 9-miler.
Yeah.